Hello, my name is Nurse Pauline RN. Welcome to my channel. Today we're going to be talking about immobility. The goal of my channel is to assist nursing students to be successful in their fundamentals of nursing exam. Today we're going to be talking about hot and cold application, heat and cold application. Cold application decreases inflammation, decreases bleeding, decreases fever, decreases muscle spasms, and decreases swellings. Heat application examples are warm water compresses, warming blankets, whirlpool, thermal heat pads. Patients with heat application monitor temperatures, prevent burns. Heat and cold application, when you use them, use a barrier, use a towel or a pillowcase. You can place them in a pillowcase, wrap around to prevent the patient's skin from getting burned. For sprains, we'll think ice. SPRAINS for pain and swelling, think about the acronym RICE. Rest, ice, compression, elevate the extremity. Monitor prominences for burns, especially for immobile patients. Do not apply heat 24 hours after injury. Edema, active bleeding. Moist heat examples are hot packs, hot compresses. Warm soaks examples are warm water in a basin. Sitz bath for patients after childbirth, hemorrhoid surgery, incision and drainage of rectal abscesses. Example of dry heat is hot packs, warming blankets. Place all on low temperatures. For cold applications decreases inflammation, decreases swelling, decreases fever, decreases bleeding, decreases muscle spasms. Cold moist applications examples are cold water compresses, cold water soaks in basins. Dry applications examples are ice packs, ice collars, gloves, place ice in gloves. Cooling blankets to decrease fever in patients. Diabetic patients with neuropathy has decreased sensation to hot and cold. Diabetic patients with neuropathy, especially the immobile patients, they are at risk for injury, which is burn. Immobile patient at risk for injury and tissue damage. Cold applications are not for patients with vascular insufficiency. Signs of symptoms of DVT, warmth, pain, edema, redness. Assess pulses. Pulses weak, pulses absent. Report to the doctor. Assess skin integrity for cold compresses. Assess if the skin is too white. Assess if the skin is too cold. Check pulses, check capillary refills. Prevent burns. Assess movements, assess sensations. For patients with hot compresses, assess that the skin is not too red with hot compresses. With cold compresses, assess that the skin is not too white. Back to Hot compresses assessment for the skin will assess the pulses and capillary refills. Pulses very weak or absent, notify the doctor. For hot compresses assessment will assess sensations and movements. Post-op patients coming from the PACU, they will have on SCD. This is SCD is a machine we wrap around the calves and attach it to a machine at the foot of the bed. It's to prevent DVT, to prevent thrombophlebitis. All post-op patients after surgery, the doctor will order this while they are in bed. They are not up running around like us. It assists them with their blood circulation, assists their pulses, please. Thank you. Please hit the like button. Please hit the thumbs up. Please subscribe. Please have a good day. Wish you success in your exam.